Hello, my name is Mary Carol Stith, and this is my video discussion for perceptions of individuals who have articulation and phonological disorders, and how those perceptions change via the lifespan. I have multiple experiences with this in multiple contexts. Honestly, I kept thinking about my personal experience, but the question was for how we would talk to peers about it. But quickly, I just wanted to say, I've had to learn how to shift in my perception of adults, especially who have speech impediments or different speech disorders or articulation disorders. It is just so tempting, and it's just our natural thought process to assume that their brain and minds work differently just because the words coming out of their mouth or how the motor function is happening is different. And so I have learned, or have had to relearn, how to engage with those individuals appropriately in a way that is respectful and honoring to them. So that goes into how I engage with any peers that I would be discussing this about, whether it be someone I'm talking with at a camp that I've worked at for families who are affected by disability, or when I'm talking to someone about my job. I am a self-contained teacher. I have K through third graders in my classroom. Most of them are nonverbal or have very low verbal ability. And so I have many opportunities to speak with my students' peers and talk with them. And I love young kids. Sometimes it's really harsh and mean honesty, but they're saying the things that adults are not willing to say or ask. And so a lot of times we'll be walking down the hallway, or I'll be pushing a friend in a wheelchair, who knows what, and a peer will say, "What's wrong with her?" or why does he talk like that? And instead of scolding that child, I want to thank them for asking a question and being curious and encourage that in a more appropriate way. So I love getting to talk with them about, this is their name and this is what grade they're in, what grade are you in, and they are going to this special, and just normalizing children, that they are still children, that they are people first and not their disability or however it is that they are articulating. So I use the same approach when I'm talking to peers. If I'm explaining to my peers that, yes, you learn how to hear and interact with someone who has articulation struggles. I read one person's discussion board that they struggle to translate for them, and I understand that as well. But being patient, I think, is the number one thing that I would tell somebody else. Be willing to sit in the uncomfortableness if they have long spaces in between their words, or if it takes them a while to say it. Be willing to sit in that uncomfortableness and wait, because it's worth hearing what they have to say, that they have a voice. And just because the conversation doesn't happen like a normal person's conversation goes, that doesn't mean it's any less valuable or worthy to have. And so I think I love bringing back worth and value and person first. Yes, here are all the things they need to work on. Here's articulation things. We can work on those in the proper spheres, in speech therapy, in school, in whatever service provider they have. But if the relationship is a friend or a companion or whatever that relationship is, engaging in it appropriately, and age appropriate interaction is a helpful phrase to remember too. How old is the person that I'm speaking with, and engaging and treating them at that age, at an appropriate age, because it just gives them the dignity and respect that they deserve.